The next topic which we will be dealing is leprosy. It is also referred as Hansen's disease. Now, leprosy or Hansen's disease is actually an infectious condition and it is caused by Mycobacterium leprae. Okay, the organism responsible is Mycobacterium leprae, and most of the time it affects the peripheral nerves. It can also affect your skin, muscles, eyes, bones, then testicles as well as the internal organs. And most of the time it is affecting your skin. Now, the definition of leprosy, which is also called as Hansen's disease, it is an infectious condition which is caused by Mycobacterium leprae and it mostly affects your skin and peripheral nerves. And it is characterized by few features. Now, these can be told as the clinical symptoms also or the signs also, and it is associated with some cardinal features. Now, first cardinal features that we see in leprosy is hypopigmented patches. Okay, the skin will be having all over in the body. Sometimes they can have hypopigmented patches, that is, some color discoloration will be there, lightly pigmented areas. Along with that, these patches, there may be partial or total loss of sensation. Okay, so when you touch these patches, usually they can have partial or complete loss of sensation. They may not even feel that you have touched the particular area. Next is they can also have presence of thickened nerves, and then next is there can be presence of this bacilli in the skin as well as in the nasal smears. So most of the time if you take the nasal swab or even from the skin, if you are taking the scrapings, you can separate or you can find out the Mycobacterium leprae. And other than that, what happens is in advanced leprosy stage, the person can have lumps all over the body or they can develop with nodules, especially in the face region, in the ear region, and sometimes that may result in ulcers also, and they can have loss of fingers or toes, and they can have depression all over in the body, and that may result in claw toes. I will show all these pictures of the symptoms, and then that may result in deformities. So the etiology is it is most of the time caused by Mycobacterium leprae. The risk factors are the people who are infected. If you come in contact with these individuals, there is high risk of developing leprosy. Next is people with low immunity can get it. Then it is also told that genetic defect can be one of the major risk factors, and armadillo exposure. So this animal exposure can also be one of the major risk factors. Next is now all the ages and all the genders can get leprosy. Okay, and 95% of the people who are exposed sometimes do not develop the condition very early, and it can affect not only your peripheral nerves, skin, sometimes your eyes, bones, respiratory system also can be affected. So this is what I was telling about. So in the face you can see that there is a hypopigmentation. Along with that you can see the presence of this ulcers, like then this is the patches that is present. So initially the patches will be developing and they will be having loss of sensation in this patches region. Next is mode of transmission. Now most of the time very close contact with the infected person can be one of the major causes. Next one is droplet infection. Then when you are having contact with the fomites, that is contaminated clothes or the linen which is handled by the infected person, in that case you can usually develop with leprosy. Next is moving on to types of leprosy. We have got lepromatous leprosy, tuberculoid leprosy, and borderline leprosy. Now, lepromatous leprosy, it usually affects your respiratory system, eyes may be affected, and even your skin is affected. Next is tuberculoid leprosy. It usually affects your skin, fingers, as well as toes, and it is also referred as multibacillary leprosy. Now, borderline leprosy means it is usually affecting both the types, both the lepromatous as well as the tuberculoid type. Now, what can leprosy people leprosy do to the people? Now, most of the time when they are affected with leprosy, usually there is discoloration or hypopigmentation of the skin. Leprosy will also destroy the neurons. So that is why what happens, you are not having adequate sensation. Okay, and leprosy will also cause the cartilage to be absorbed back into the body. So that is why most of the time what happens is there is deformity of your body. The patient will not be having fingers, toes, ears or nose. So because of the loss of this cartilage, the patient's nose, toes, ears or fingers may start to disappear, and that will give a large bump. Sometimes the patient can also have a large bumpy area on the skin. So here in the previous image you can see here bumpy areas are seen on all over in the face. So that is actually the next cardinal feature that we see in usually leprosy. And usually the person may not feel sometimes pain, and usually it may not heal fast. Next is diagnosis. Now, most of the time, based on the clinical signs and symptoms, we have to do the diagnosis. Then, skin biopsy can be done, scrapings can be taken, and you can find out the microorganism, that is, Mycobacterium leprae, can be usually detected after taking the skin smear or the biopsy. Next is one more classification which we have got, that is referred as the Indian classification. So first one is indeterminate type. In indeterminate type, usually it denotes whenever there is one or two hypopigmented areas. Okay, the patient will be having one or more, that is usually one to two hypopigmented area, and that hypopigmented patches, usually there is loss of sensation. The second one is tuberculoid type. So you can see in the figure here. Okay. So in this type, usually the patient will be having one or two type of lesions, and these are actually flat or raised. You can see these lesions are flat and they are raised also, and they are hypopigmented, isn't it? It is the skin color is changed from the other side, and then usually it is somewhat like erythematous. You can see that there is redness also, and there is loss of sensation in this area. So that is the tuberculoid type. Next one is borderline type. So borderline type of leprosy, this type is with four or more lesions. Many lesions may be seen here. They may be flat also, or they may be raised also. And usually they are hypopigmented patches which are erythematous. Erythematous in the sense reddened areas. And these are usually with sensory loss. Okay, here also there is loss of sensation. So that is borderline type of leprosy. Next one is lepromatous type, which we have seen. Now, lepromatous type, here what happens is the person will be having raised or diffused infiltrated areas. You can see here all over in the face. Okay, some lesions are there, and they are shiny, smooth also, and usually they could be flat and raised areas, like bumpy areas are seen. You can see in the patient's face here. So next is the clinical features or the clinical signs. So as I have told, patient develops skin lesions. Next is hypopigmented areas will develop with erythema, okay, or with patches. Then patient will be having loss of sensation in these patches where there is hypopigmentation. There is loss of sensation. Sometimes initially the patient can have paresthesia, that is numbness and tingling sensation may be seen in the hands and in the feet. Then decreased sensation or complete loss of sensation may be seen in these skin patches. And usually they may have wounds and all, and they may feel that it is usually painless. Then next is the nerves will start to thicken, especially the peripheral nerve thickening will be there. And I have told there is loss of cartilage. So because of that, usually the person's nose, ears or fingers, they may start to disappear. And the patient can also have sometimes tenderness or enlarged peripheral nerves. So here you can see this is a claw hand. The patient has developed claw hand, and here you can see the deformity that is usually because of the loss of the cartilage. Okay, slowly they will start with these deformities. Next is treatment. Now the treatment of leprosy is commonly we give the drugs dapsone, rifampicin, and clofazimine. So the combination of these three drugs is called as multi-drug therapy. So these three drugs are usually given for the treatment of leprosy. Next is we have also got a 6-month regimen. So in 6-month regimen, we usually give Dapsone 100 mg, Rifampicin 600 mg. So Dapsone is usually given 100 mg daily, while Rifampicin 600 mg we give monthly. Next, we have also got 12-month regimen. So in that we give dapsone 100 mg daily, rifampicin 600 mg monthly can be given, and clofazimine you give 300 mg monthly, or sometimes you can give 50 mg daily. Next is complications of leprosy. Now complications are, it may result in most of the time deformity or disfiguration. They can have loss of eyes, that is eyesight may be lost, eyelashes may be lost, they may lose their ears, then there can be permanent nerve damage, there can be paresthesia, nasal bleeding, they may not be able to use their hands and feet. Then in the eyes, they can also have other deformities like blindness, sometimes iritis. Iritis means inflammation of the iris, and it may also result in glaucoma, that is, patient can have decreased sensation of the optic nerve, and along with that, increase in intraocular pressure. So most of the time, the patient can also have infertility, and kidney damage may also be seen. So this is particularly about leprosy.